Good morning and welcome to our presenter interview with Dr. Sandip Buch. My name is Jamie Gary. I am the owner of UpVision Consulting LLC. We are a full service legal nurse consulting firm and the host of ARC 2026, which is also known as the Attorneys Resource Conference. This conference is a dynamic platform for attorneys, legal nurses, healthcare professionals to all come together to improve strategy for case litigation, improve professional practice, and to improve the ability to identify and mitigate risk. I would like to take a moment now to welcome Dr. Buch. And Dr. Buch, can you please tell the audience a little bit about who you are and what kind of work you do?
Yeah, thanks for having me. I'm a psychiatrist. I run a psychiatric company, a group private practice called skypiatrist.com. So I'm a clinical psychiatrist, and I also um, have recently been doing more medical expert witness work. I kind of was exposed to it originally. My first job was at Rikers Island Prison. I also did a forensic psychiatry fellowship in residency. And then I worked at Bellevue Hospital as part of NYU faculty doing in the forensic psychiatry unit. So doing clinical treatment for anyone in any New York City's jails um, who need to be hospitalized for a psychiatric reason. And there I got exposed to a lot of like forensic psychiatry work and insanity defenses and competence to stand trial and things like that.
That's all very interesting. I think there's a natural curiosity when we get into correctional medicine. So I'm excited to listen to your presentation. What drew you to present at ARC 2026?
I recently got more into expert witness work, and I love it because I think it's very important to represent psychiatry accurately in legal settings. And I think psychiatry is one of those, we have a lot of diagnoses that are made that there is no like real test to verify. Like, if you diagnose someone with pneumonia, there's actual infection of the lungs. But psychiatry, if you say someone has major depression, it's not something that's as easily verifiable in an objective sense. And so I think there's a lot of room for misrepresenting what psychiatric illness is. And I think it's so important that we do it properly in courts and everywhere in life, but especially in courts because there's so much consequences. I also do I've continued to do a lot of workers' comp evaluations and things like that where there are some damages to be assessed. And so it's important that we say what psychiatric illness is and what it isn't.
I think that's wonderful. And thinking about the importance of your topic, in a snapshot, are you able to give us an idea of what your presentation will be about?
Yes, it was based on a case that I did, and there was a jailhouse suicide, and the case was if a psychiatrist was called, the person had refused the psychiatrist, but if the psychiatrist was called, that would have resulted in the person not committing suicide. And I don't want to get too in the weeds of the case itself because I think I learned in thinking about the case, I learned something that I think is very applicable to expert witness work, which is you have to prove, with the preponderance of the evidence, or more likely than not, or greater than 50%, that had something been done or not been done, depending on what side of the argument you're on, that something would or would not have happened. And I think a lot of times that kind of thing is argued in vibes, like, well, I think if this didn't happen, when we're planning, like it's just a complete hypothetical. Like had we changed these initial conditions, then I'm just going to present, this new version of the universe, and it would have happened this, and then someone else can easily say, well, I don't think it would have happened like that, and then we have psychiatry, which is sort of soft to begin with. So I think there is a lot of there's a lot of gray area, and I wanted to understand how we might make that easier. And even the question when it was presented to me, I was not sure. Like, okay, had a psychiatrist been called what would have been the difference? I don't know. How do I and I needed more clarity because if I'm going to argue something, I need to be sure about it myself. And I don't want to, I never would change an argument based on who's asking me to make it. And then I kind of realized that, when we ask if something was different, what we're really asking is a basic law of probability. In that, it's not that had a psychiatrist been called first, the person would have had to agree to see the psychiatrist. Then they would have had to agree to take medications. And this is all what doctors do all the time. So we understand this, that each one of these things, a lot of people don't want to see a psychiatrist. In this case, he happened to have refused psychiatrists other times. And a lot of times you recommend people take medicine, they don't take it. Even if they agree to take it, they won't take it every day. Even if they take it every day, it's not like medicines are 100% effective. It's not like that would have, resulted in an improvement within a given time frame of whatever condition. And we have to say that someone committed suicide because of a medical condition. And a lot of people commit suicides who don't have like a medical condition or some medicine would have magically not changed that outcome. So what I realize is there are many steps when you change one initial condition. And basic probability law is that when there are many steps that, you have to multiply the probabilities of each time. Just if you flip a coin 5 times, each time the odds are 1 out of 2 that it'll land in heads. But if 5 things need to land heads, what are the odds? It's exponential. It's 1 out of 2 to the fifth power. It goes down really fast. And let's say there are 5 things that each one of those things is 90% likely to happen. Even so, if 5 things that are 90% likely to happen, it goes below 50% after 5, I think. So I think that's not intuitive for people. And it's important to realize that when there's some initial condition that has changed, to really think about, okay, this changed, but what all had to happen for the outcome that I didn't want to happen to actually have changed? And even if it's very likely, like you think, oh, he would have definitely taken medicine had he agreed to see the psychiatrist. Oh, there's a 90% likelihood, which is a vast, I think this is a vast overestimation. But even then, it's like it would have not, there's a compelling argument to say that it would not have met the preponderance standard. And I think the basic thing is that every change that you make, they're usually arguing that several things would have had to happen, and then the outcome would have been different. And to really
Sure.
highlight that.
Sure. So, as an attendee, what is it that you want us to think, feel, or do differently after we hear your presentation?
Well, as far as the medical legal question and the preponderance question, what I want is whenever a condition is changed, like this person should have seen a psychiatrist. Most people don't go through, but what all the steps just because someone sees a psychiatrist, it doesn't magically mean that they would agree to see the psychiatrist, that they would take the medicine, all the things that I laid out. And I think every legal question, preponderance, this should have happened and it didn't happen. Had this medicine been prescribed, had the diagnosis been made 2 weeks earlier, had the diagnosis been made at all, it's still there is a negative, there is a harm that happened. And break it down into steps and realize that there are steps between the change and then usually what someone is arguing, and to really
Right.
be mindful of that, to think about it, and to realize that there's uncertainty at each step.
Sure. So, who do you believe should be in the room to hear this?
uh any expert witness and any lawyer who does malpractice law.
Okay.
I think it's more helpful for people on the defense because these steps they tend to then, I think, when they all have to happen, they tend to bring it below the preponderance standard or below 50%. And I think it might be a little more valuable to people in defense, but I think anyone, when you're thinking about the preponderance standards, what does it mean and what are the ramifications of that? I think anyone would benefit from hearing that.
Sure. So, we are very happy that you accepted the offer to speak at this year's conference. Thinking about ARC 2026 in August, what are you most excited about?
Well, I'm excited to. I haven't been to a conference for expert witness. It's something I've been doing more in the past year, and just meeting every people in the field and lawyers and things like that and presenting this. So it's just not something I've done, so it's gonna be a new experience for me, and I love new experiences, and I want to get into this more, and so I'm excited about the whole all of it.
Wonderful. Well, we know the conference will not disappoint, and we're very happy to welcome you. And to our audience, thank you for taking the time to listen to this video and to stay with us. Please take time to go to attorneysconference.com or scan the QR code in the bottom corner of this video to book your seat. You do not want to miss this event, and you do not want to miss Dr. Butch's presentation.